We now move on to our next session, which is Artificial Intelligence in Digital Radiography and Computer Radiography, the Global Scenario. For this session, we have with us Ms. Shilpa Singh, Assistant Professor and Radiation Safety Officer, Maharishi Markandeshwar University, who will be moderating this session. Welcome, ma'am. Can we have a round of applause, please? Dr. Geetanjali Nanda, Consultant Radiologist, Mahajan in Imaging. Welcome, ma'am. Dr. Amit Kumar Sahu, Consultant Radiologist, Max Hospital. Welcome, sir. And Dr. Abhinav Jain, Professor and Head of Department, Hamdard Institute of Medical Sciences and Research. Welcome, sir. Over to Ms. Shilpa Singh for taking the discussion forward. Thank you, ma'am.
Good evening, ladies and gentlemen. Now, I take this opportunity to welcome our guest speakers. So, the first speaker I'll introduce is Dr. Abhinav Jain, who is an expert in latest diagnostic technology like diagnostic imaging, PET scan, MRI, nuclear medicine, CT scans, fluoroscopic procedures, ultrasonography, all X-rays, radiation protection, and image evaluation. He is also the professor and head of the department at Jamia Institute of Medical Sciences, Jamia Hamdard University, New Delhi. And he has been a consultant to many healthcare firms like ClearMedi and Fortis Healthcare. He has a vast experience of more than 10 years in healthcare diagnostics and hospital management services. So I welcome Dr. Abhinav Jain. Next speaker, who is an MD in radio diagnosis. She has also done MRI fellowship from Seoul, South Korea, and where she was also awarded with Asian Fellowship by Korean Society of Radiology. She has published many publications in leading national and international journals. Currently, she is working as a consultant radiologist at Mahajan Imaging Center and Advanced Diagnostic Specialist Imaging. She has also been associated with National Association of Blinds and ROCO Cancer in the field of breast cancer prevention. So I welcome Dr. Geetanjali Nanda. And our final speaker of the day, he has completed his MBBS from SCB Medical College, Cuttack, Odisha, and MSK fellowships from University of California, San Diego, under the famous Professor Donald Resnick. He has also presented AI researchers in international forums like RSNA. He has also conducted MSK workshops with international faculties. Currently, he is also running a regular one-year MSK fellowship programs in Max Hospital. So I welcome Dr. Amit Kumar Sahu. The agenda for our discussion is artificial intelligence in digital radiography and computerized radiography. These images help recognition of lesions and characterization of lesions, like in case of measuring the cardiothoracic ratios in cardiomegaly. This all helps us facilitate the image reporting and preparing the image reports for the patients faster. In developing countries like India, where we know that the doctor-to-patient ratio is very low, we require these kind of systems to be incorporated in the healthcare system to help the patients get timely treatment. So we will start with the origin of artificial intelligence in the radiology. How did it come to the radiology? I would like Dr. Geetanjali.
Thank you for your kind introduction, and thank you to the organizers for giving me this opportunity here in this evening. Good evening to all. Every decade we have a keyword like IT industry, smartphones, and this decade it's artificial intelligence. Artificial intelligence is not a very recent thing. This term was coined in 1959 by Andrew Simon, and the advent of AI in radiology, it has been due to the exponential improvement in the computation power of computers in the last 5 years or so. So in 2017, NIH in US, it released a database of around 1 lakh X-rays to the public with a thought process of what the researchers can come up with it. Within 2 months, the researchers from Stanford, they developed an algorithm which they say that it detected pneumonia better than the expert radiologist. And that actually opened a hornet's nest. Since then, there are more than 100 companies developing algorithms for X-ray chest only, and of them, at least a dozen are doing very well. So when NHS released that data set, they also gave the labels to the X-ray through a programming language called as NLP. And based on those labels on the X-ray, the algorithm identifies the consolidation or masses or effusion like that. We did our own research on this to establish the ground truth, whether these labels are actually true and whether they can be used to train the algorithms for further computations. We presented this in European Society of Radiology conference in 2019. And there was a lot of variability between the radiologists because every radiologist has got its own language. So even if we use NLP, the radiologists are not on the same NLP. Since then, there have been a lot of computational algorithms that have been developed. We have our own research division called as Caring DX, and we have been in collaboration with more than 40 companies around the world, Fuji and GE and Philips and all included. We have been doing analysis for them, their data, it's more of an audit for the AI, whether the algorithm is working efficiently, whether the radiologist is on the same page. So there's a lot happening and a lot more to come. This is how we are going to go about in AI in radiology. Thank you.
Thank you, ma'am. So, Dr. Amit, my next question goes to you. How far do you think the AI can go in terms of effective patient care?
So as Dr. Gitanjali told, AI is not a recent thing. It has been there for long years, decades. And of recent 2 decades, it has taken up in radiology, where it is being really effective. As he told, there's a lot of X-ray companies which have developed. So there are a lot of Indian companies who are also doing very well. And they have worked on chest X-rays, even on bone X-rays for the fractures. So they have been very effective on detecting the emergency conditions where the patient care will be needed at most. So we have very less time between the detection of the problem and getting the treatment for the patient. So the example comes like you have chest X-ray detection for pneumothorax, where you need the patient to get admitted, so the drain needs to be put. In case of fractures which are not the simple fractures, with the complicated fractures where there may be an injury to a say vessel or a nerve. In such cases, when it is detected in say a primary care center where the doctor is not available at that point of time. So in that cases, what happens? So once the detection of this thing, so if the clinician is there to help it out, so it will be like the patient gets the utmost attention and the patient gets life saved. This is what we are having till now effectively on clinical practice. Going forward, what we expect is there should be a the collaboration or coordination between the radiology AI thing with the clinician. So suppose the AI detects something and the alert goes to a radiologist. So if the, say on-call radiologist is there, and if he is he can say or convey the findings to the clinicians effectively. Before that, he has to assess whether the AI has done the correct assessment or not, because till today, when we are seeing a lot of AI companies, they have worked together, a lot of deep learning has been there, but still there are some flaws in the AI which needs to be corrected, though they are being done in gradually. So in that case, what happens in future if there is AI detects something and then the radiologist is there or the radiologist is not there, based on that the clinician or the treating physician gets the information that this is what it is. So the patient life will be saved in emergency conditions, and also the effective treatment can be done. So this is what we expect in future, though it is not up to the mark till now, but the companies and the doctors, radiologists and the hospitals, they are working in that step to move forward.
Thank you, sir. Dr. Abhinav Jain, so being an academician, what do you think how the incorporation of AI into the clinical setup would impact the medical education?
Thank you for bringing up this issue. Thank you for bringing up this issue. This is a very relevant question, As Dr. Nanda just mentioned, that artificial intelligence has not been a new phenomena. It has happened over a period of time. And during this period, the educationists, the medical education especially, were always alarmed that something new is happening. What will it, whether it will have an impact on the radiology education or maybe radiography education or not. So I happen to be a part of the medical education team of our institute as well as the National Medical Council Nodal Center. So we did have a deliberation over it, and we came to certain conclusions, and I'll just share with you. Let's say you have a student who is doing a bachelor's course in medical imaging technology in your institute, and you have a beautiful machine which is enabled with artificial intelligence features. It can automatically detect the patient's body habitus, body's weight, body height, and variations in the pattern of the body. And then it can automatically adjust the KVP and MAS values and get a very good desirable image. Even the positioning is not required. And that's what we are seeing in AI as it is happening. So whenever we talk about a teaching institute, if we procure such a machine, I'm really wondering whether we'll be able to train our radiographers into real radiography or not. So yes, and when the patient is in a critical position, or if a patient comes in a some uncontrolled environment, then whether our radiographers will be able to deliver at that time or not. So there might be some limitation in their capability which they can develop over a period of time when they really deal with the real machines. And this is something which is going to be in future, but right now I don't think incorporation of AI would be very helpful at this stage in the radiographer training. Now let's come on to the medical doctors, radiologists, when we train them. Again, there are a lot of softwares. During COVID times, we had a lot of softwares coming in, AI algorithms coming in, which could actually filter out the normal chest x-rays from abnormal, thus giving you an opportunity to work only on the abnormal x-rays and saving the time. But what I realized again, my residents who were under training, they started filtering out the x-rays with the algorithm, and they never paid attention to the normal chest x-rays or the normal radiographs. So what the repercussions were, see again, the medicine is not just based on the image which you are seeing. It has a lot of inputs from the clinicians, the clinical history, the background of the patient, and other things. So once you have a comprehensive picture of a patient and then you correlate even with a normal x-ray, then you get a lot of information about it. So, and also we teach that you look at 1,000, 10,000 normal chest x-rays, and then you will start recognizing the abnormalities. So if you stop looking at the normal, you'll not be able to find out the abnormalities when actually they are there. So there are certain issues which are there in artificial intelligence in medical education, as you asked me particularly. I'm not against AI, but when it comes to the education part, then we need to be careful, and these issues need to be addressed.
Thank you, sir. Dr. Gitanjali, what do you think are the challenges in implementation of artificial intelligence in the clinical practice?
The first and foremost is a robust algorithm. I really have to believe that AI algorithm to have faith in its report. The AI algorithms that we have right now for chest x-rays, they are quite robust. They give a lot of data in the sense that they give probabilities of different lesions. But at the end of the day, they are not contextual. They don't have any relevance with the clinical history. And there are a lot of times, when there's a lesion lying there for since last 5 years, still the AI will mark it as a malignancy or a mass. So the contextual part of AI is still being developed, and the relevance of the findings with the patient's clinical data is yet to come up. That is the biggest challenge. The second challenge that I feel is that everybody has to be on the same page, and this is what I feel that we are doing right now, that the user, that is the patient, the beneficiary basically, the patient is a beneficiary, the user is the radiologist, the companies making the AI, and the government making the policies. Everybody has to be on the same page, all stakeholders going towards a common goal. It is not just a commercial deal that we are making the algorithms and selling it off. It is a lot of ethics and morals involved here. And we have to keep everything in the loop so that at the end the patient is benefited the most. Another thing is that we have to take care of the ethical part, the regulations, what is the medico-legal implication of an automated report, Who's going to answer the patient that, AI has generated a report and this is what your finding is? There has to be a person behind it. So AI can do the pre-readings, but the final signatory has to be a person, a trained radiologist, and it's, in the end of the day, we are hand-holding. I mean, if any of us, we have seen in COVID, any of us, we don't just want to see our reports. It's CT score. I mean, it was a disaster and a nightmare for a lot of people, like 22 CT score. It's like, there has to be something behind it. So automated reports can just be a print of paper. There is a lot of information, empathy, and compassion towards the patient that goes in radiology practice. It is not just a report.
Thank you, ma'am. Dr. Amit, what do you think are the problems, the challenges in preparing effective deep learning solution?
Before answering this question, I would just add to Dr. Nanda's thing. So other clinical, so the problem which we are facing is the integration of the AI different softwares with the current packs which we are using. So say there are 20 companies who will detect pneumonia on a chest X-ray. If we want to integrate, say 2 or 3 of them, so the integration with the AI with the UI is a very challenging thing. Because the thing is, so suppose we are using a company called XPACs, so the AI, they won't agree to the integration. So what is leading to it is now the AI companies, they have started having their own pack system. So now in the market there will be n number of AI companies, n number of pack systems. We don't know how efficient the AI is, how efficient the packs is. So this is another challenge which we'll be going to face very recently.
I would like to answer to this. So we are looking for an Amazon. Okay, everybody is making their stuff. There has to be a platform which is established, user-friendly, and you can go onto that platform and buy your stuff. We have actually made that stuff. So we have a platform called as Kapil. We have deployed it with Niti Aayog. We have deployed it in Singapore and a lot of US cities and in the universities. So it is basically the Amazon of AI softwares. Everything gets loaded into it and your data gets loaded onto it. You get a parallel report. And then you can have a second opinion. So it's like, you have an assistant sitting. I will call it not an artificial intelligence, it is assisted intelligence. So you have a second opinion that's very helpful for people sitting in tier 3 cities all by themselves doing all X-ray, ultrasound, CT, MRI individually. So there's one person per center. In such a setup, if you have a backup, somebody validating your finding, and you have a look that, okay, I'm thinking this, and AI also is saying the same thing. It's very, very beneficial. So in these setups, you need basically a one-place go-to solution. So that is what we are trying to do. We're trying to make that thing, that we are taking algorithms from all the companies across the world, putting it at one place, comparing them, putting them on top by the rating, and from the user convenience, and then we are trying to give it to the market.
So in that case, what is the thing? So you have to validate the number of companies which they are actually effectively doing it, because nowadays what's happened, there are a lot of startup companies which have come up. Everyone is interested in chest X-ray AI because that is the most easy thing. I don't know about the engineering part, but that is supposedly the most easy thing to do. So everyone is there. So we have tried a lot of companies, AI companies, and we have seen the variation in each. And so if we give the same 10 X-rays to 1, 2, and 3, and 4, so the reporting which they generate or the analysis which they do are all different, and it is sometimes it is like it's very, very difficult to say.
That's true, sir. Thank you, sir. So, Dr. Abhinav, sir, what do you think are the key challenges with AI in clinical practice?
Okay. I think it's a continuation of what we have been discussing. So I'll add on to that. Rightly said by Dr. Radna that there are all these algorithms which are available. Many of them have been prepared in isolation, where the clinicians have not been a part of development of these processes. Most of the data scientists and the AI software engineers who are sitting in isolation in some laboratories, they are working there. Of course, there are certain companies which have roped in 1 or 2 radiologists who are helping them in understanding the images. So as on date, if you talk about the limitations, this is one of the biggest limitation where the source of the information which has been used to generate the data, to generate this neural networks, they are not so robust. There is a lot of discrepancy, there is a lot of differences in opinion. Even amongst two radiologists, there are differences in opinion. So how can we trust one person who has developed that kind of algorithm? Now coming on to other limitation is that, again, rightly pointed out, if you have a report which has been generated with the help of AI, and suppose you land up in trouble, there is a report which is being questioned by maybe medical council, or a patient has got a wrong diagnosis, then who will be responsible? All of us are well aware that when we use certain softwares which are available with the X-ray machines or ultrasound machines, they generate beautiful images with the help of artifact reduction techniques. Many a times these artifacts are actually required to make a diagnosis. And then if you reduce them artificially with the help of a software, that produces a bad image. That's what I call it. Although appealing, but it might be bad. You might be missing a small VSD in getting in the quest to get a beautiful 3D of the heart. So if that happens with AI somewhere, and I miss a diagnosis, who will be responsible? That's the big question now being asked. If there is a medico-legal case, can I say that the person who produced this software or the company which is selling this software should be sued rather than me? That's something which is to be addressed, and that's not giving us confidence. Again, if you do not have a confidence on one kind of application which you have to use in your practice, we are dealing with patients, the humans, where every diagnosis will have an impact. We can't take risks. So right now, I think that confidence is lacking, and that's one of the biggest limitations here.
Thank you, sir. Dr. Amit, sir, how effective do you think AI is as on today in clinical practice?
I will just continue with Dr. Abhinav. So what he was telling about, I think the training part of the AI. So again, the challenge is in India, we don't have a good incubator for a AI training program. So most of the engineers who are preparing these softwares, so they do it in isolation, and as correctly said, there are few radiologists who are there. So I can give an example of a state where they have started helping the AI startups, where the radiologist has to give, say, X number of hours apart from the normal working hour without getting any remuneration, and he has to give the help to the AI company. So in that case, what happens, and surprisingly, it was 500 chest X-ray per day. So the radiologist has to validate. So these are the challenges. So we need to have a proper incubator, say either a government hospital or a private institute, and then the training to the developing AI software startups, they needs to be done properly. Sorry.
So that's a very interesting topic we are discussing here. And if you had seen today's newspaper, The Hindu, there was a big article on ethical issues of artificial intelligence. So there are various softwares which were developed, like one of them which can recognize the face of the person and project what you will look after 20 years from now or 30 years from now. And the big surprise which came in, like if you put in the picture of Barack Obama, after 20 years he becomes a white old man. So this is a kind of bias which is there in the data. The scientists who developed it, they used all the white male images as they progress into the different ages, and what we have here. If I put my picture, I'm something else then. So that doesn't gel well. And if that happens with AI, again, where you are using the radiomics and you're using the texture analysis of the images to produce the diagnosis and the future outcomes of a particular disease. Do you think, I mean, the same kind of things will work for everyone? A software, an AI algorithm which is developed in maybe US will work in India or will work in South Africa. So that's going to be, there are going to be a lot of variations. And so far, I think the data robustness is still not there. And therefore, UNESCO had taken up a very important step of discussing about the ethical and other issues in AI. And they are coming up with resolutions which will help us in standardizing the things and maybe where exactly these AI algorithms can be implemented.
I think Dr. Abhinav is trying to say that the AI algorithm made in US can never pick up tuberculosis in India because every third X-ray in India has got tuberculosis and they don't know it. So what happens is with the heterogeneity of the data set that is used for the training, If it is an open source data set that is like in US, then there are a lot of things that never happen there. They won't pick it up. Dr. Amit said that they are using AI algorithm for detection of pneumothorax. So going back to the same thing, when this data set was released by NIH, we did manual marking of pneumothorax for GE for 80,000 chest x-rays. There were radiologists who were sitting it day in and day out, marking the pneumothorax for them so that the algorithm can be trained on that ground truth validated x-rays. Now, those companies who are making the algorithms, are they going to go to this length for each and every disease? I don't think so. GE made one proprietary software only for pneumothorax. It has put it in the portable chest X-ray machine, which Max Sackett is using. But a lot of manual effort went into creating that one software. It's a long way to go.
But that portable, so I'll just tell you that the portable chest X-ray machine. So this was basically used bedside machine, and mostly it was used in the night times when the consultant radiologist or the house of the radiologist is not full. So in that case, what used to happen, most of the bedside X-rays which are done, so and all those X-rays definitely have some findings. Apart from the follow-up X-rays, if you have a fusion or a consolidation, but there are suddenly new findings pop up at night. So they used to, the machine used to detect that, and then the alert used to go to the mobile of either a duty radiologist or the clinician in charge, or whoever. So whoever the mobile setup is done, so the alert instantly used to go to that. So it was very effective, and we are still using that. Though even at midnight the pop-up is there in the mobile, the radiologist opens the scan or the X-ray and sees it, and then only conveys to the clinician. But in future it will be very effective.
True, sir. So my next question is, Abhinav sir, what do you think would be the key areas for the researchers to work in computerized radiography and digital radiography for AI enablement?
Okay. So I don't think many researchers are sitting here, but what exactly I feel is, as we have been discussing so far about making the diagnosis with the help of AI algorithms and other things. So we understand, whatever we discuss, that it is still in a development phase, and it's going to take a long time. I'm not an antagonist of AI. So again, so what we are doing is like, it's something which is going to happen in future, and definitely it's going to be there. But as of now, what the AI scientists and people who are preparing the AI algorithm should focus on the acquisition part. Maybe there are remote areas, again, as I said, in our country, where we do not have access to basic radiography. The automated positioning, automated capture of the images, and all these technical parameters can be taken care of. And this is going to help you definitely in getting a good quality image, which can be ultimately relayed to a radiologist who is sitting in a tertiary care center and can provide their inputs. Other than that, if you really want to make good efforts and help the radiologists to do their work faster, the good softwares, good AI algorithms which can actually help you in preparing the reports. Maybe if you are reporting a tumor and you get a pop-up of the WHO or ACR classification to do the reporting for that, that can be more useful. And the reports, if they can be generated with the help of lesser plex, the things which you usually put in a chest X-ray or in a other X-ray report, that comes on automatically. That's going to add on value and reduce this reporting time. Similarly, we saw a lot of voice recognition softwares which can actually, with the help of AI, recognize what you speak, and they train according to your language and your vocabulary and other things. So they generate a faster typed report. So such things should be the prime focus. And of course, the clinical application should go on side by side. Once we are ready with them with a very good validation and a good amount of robust algorithms, then we should definitely use them in our practice.
Thank you, sir.
Another field where we really want the AI to go is the screening, cancer screening. So if we are talking about radiography, so one is the lung cancer, and in mammography there is the breast cancer. So if this can be used effectively in these two fields in Indian scenario, it will be of great help. Other thing is early detection of tuberculosis, which there are companies which are doing and they claim they're 99% plus effective. So in that cases like the slum areas or the rural hospitals where this can be a portable X-ray machine can be set up, and then they can be detected, early detection of this thing. Similarly, there are many NGOs who are already working in the hilly areas and deeper remote areas in Jharkhand and Uttaranchal also, where they are having the portable mammography machines. So I don't know, I don't have any data or any information how effective they are, but definitely if the AI works properly, so in those cases the detection of breast cancer, as we are seeing now, it is also the incidence is increasing up in rural areas also. So the detection of the CA breast and mammo, that will be very effective. I think companies are working on that also.
True.
I'll just add on to that, like I've worked with Roco Cancer, so they have their portable van with the mammography machine. And they have a dearth of radiologists who are going to report this teleradiology mammography images. And most of the times the reports come out to be Bired 0. So then the patients, if they are clinically palpable masses, they are brought to for the ultrasound, and it becomes the double the effort. So if there's a robust algorithm which can detect, there are at least 3 algorithms which are very good with mammographies. And we are of the opinion that run it through all 3. So, if it is abnormal through all 3, then you can bring the patient and really help them. So this is one area that it is really, really required. And also in the National Tuberculosis Program and occupational screening, all these areas where the national programs are there, the AI can take over. It has already taken over immigration departments of Dubai and Canada. So programs can be, efficiently managed with AI.
Amit sir, do you think AI is helping or replacing the radiologist?
That was the biggest question which came when AI came into effect. So definitely the answer is no. So AI is not going to replace the radiologist, that's for sure. So AI is being developed by the radiologist itself, just to help them out. So in today's scenario as well as in future, so AI will definitely help in increasing the efficiency of radiologist. I will give you an example. Supposedly I come in the morning, I open my packs and I see that there are 250 X-rays which are pending. So if the AI has done its work overnight by say triaging the X-rays into emergency, non-emergency, normal, abnormal. So now when I come, I first will have a look on the X-rays which has been detected as emergency findings by the AI. So what happens, so now the patient also, the clinician comes to know the findings first, the patient treatment starts early. Now the cases which the AI has told to be normal or says non-emergency, I will have a look later on. Definitely I will look into it and then, so here what is happening, so instead of say 3 hours morning coming and giving to the X-rays, where I am also giving more time to non-emergency X-rays which could have been delayed by an hour, I have given time early to them. So this is a big place where the AI is going to help. Similarly, say if we are talking about radiography only, so detection of the lesions. So in chest X-ray, always a challenge is detection of nodules. So the nodules can be, the nature of the nodules can be anything. It can be metastatic also, it can be a cancer also. So sometimes we do miss a nodule in the chest X-ray and say the AI has detected a nodule. Maybe it is not a nodule, but if it is detected, so definitely we'll have a relook if the radiologist had told it to be normal. And then we can say, and it is the radiologist's final call, whether it is abnormal or normal. So definitely the AI is helping, it is increasing the efficiency, and it will do, in fact it will increase the efficiency more in future, but it is not going to replace the radiologist forever.
So we can summarize it as AI is definitely going to help and increase the efficiency of digital radiography as well as computerized radiography, but it cannot replace the radiologist. Of course, it requires radiologists to look at the images and check and analyze the reports. Am I correct, sir?
In short, you can say that we are AI auditors. So we're going to audit it.
So with this, we close our discussion. And thank you, sir. Thank you, ma'am.
Thanks.
I'll humbly request the panelists to just join us for 2 more minutes. We have a small felicitation ceremony also. So my apologies, I had to rush for something urgent, so I couldn't be here, but if you could join us for 2 more minutes, please, on stage. In case any member from our audience has any question from our panelists who are just, giving their very insightful discussion, we can pass it on the mic and, have a discussion, mini discussion. While we are just waiting for our chief guest to arrive, he's on his way. He should be here very soon. So are there any questions for the esteemed panelists here? Any questions? Please, can we have the mic? If you could introduce yourself and also to whom the question is directed.
Actually, I have 3 questions for all 3 of them. So I'm a junior resident at the All India Institute of Medical Sciences, Shubhrankar. So my first question is to Dr. Gitanjali. So I'm aware of the work they are doing at Mahajan with Carpal, and she mentioned that she worked with around 40 companies who have created AI algorithms. So what I want to ask is that how many of those are actually working with not only the imaging data, but also the contextual clinical data?
None of them, very few, because it's very difficult. So the main focus is to develop a efficient and robust algorithm. That itself is a tall task, and every disease is different. So they have very good algorithms for detection of lung nodules on CT chest for cancer screening programs. They are the most efficient ones. Chest X-ray algorithms are also very good, but none of the algorithms puts any clinical perspective into picture. If you give them a CT scan dated 2015 and 2020, it will detect COVID on both, and COVID was not there at that time. It's not working like that.
Thank you. My second question would be to Dr. Amit. Yeah. So, sir, you mentioned that screening is an area where these AI algorithms can play a big role. So, sir, suppose the AI algorithms take over the screening programs which you have in India, and you also mentioned that they are not going to replace the radiologists. So, what is the return on investment for the, let's say, private sector companies who are using the AI programs? They're already having the radiologists, which they had. They're paying the radiologists, but they're also paying the AI companies. Where is the return on investment?
Sure. Okay.
So the thing is, now the AI company will be, so suppose I am in a private setup. I have purchased a AI company. Now the thing is, if we are doing say 200 X-rays in a day, being AI into the our work sphere, so we will be able to do 300 X-rays in a day. So that ways the number of studies will increase. So that will compensate for the charges or whatever the remuneration you are speaking of. Other thing is it's not about just the money which is there. So it is a field where the health is into there, the patients are into there. So always you, even if there's a private institute, they won't think that always the money is a main factor. So we have to give a efficient patient service and also the patient satisfaction. So that also needs to be considered. So definitely AI will be also there, radiologist will be also there. So all will work parallelly, and finally it will be more efficient work.
What is trying to tell you is that AI is not taking my job, but it might take yours.
Right, thank you. My last question to Dr. Avinav. So, sir, where is AI being used currently in the country apart from the big institutes and the imaging centers?
Yeah, that's a very valid question, and that's what I was raising here, that whether AI has made its percolation into the society or not, how deep it has penetrated. So as of now, you are right that most of the places where AI is used are tertiary care hospitals or research institutes, or even those who are developing their own AI algorithms and practicing and using them at their centers. So that is a fact. But to give you a perspective, I personally am a part of a very large project wherein we are developing an soft a machine which can actually go and work in rural areas, wherein you can actually, it's based on ultrasound, so where you can actually help the pregnant females and other disabled people who might not be able to access ultrasound care at a district level or some other place where it is actually available. So we have already started a pilot project, and it's being done in one of 3 villages actually, and we have found very promising results. The basic requirements, basic things which we wanted to know out of that software is being delivered. So I feel not today, but maybe 1 year down the lane, you will see a lot of impact of AI in rural areas especially. Then, of course, in the clinical practice, as I said, it's going to be a time testing thing. As everyone has already pointed out, it's not a very robust kind of algorithm which is there, and it requires a lot of validation and amalgamation of all kinds of populations to get a good outcome. Also, if you talk about technical parameters, yes, AI is there, and most of the vendors have come up with good AI solutions where the machines are actually acquiring the images in a better way as compared to when only humans are operating them. So this is one thing which is already there, and this can be implemented almost everywhere.
Thank you, sir.
Thank you. Thank you so much for your questions and for the responses from our esteemed panelists.